Hello, I wanted to give you guys an update on some things that were going on and also let you in on some ideas that I've been working with. First thing I wanted to talk about was what's personally been going on with me. For the past 5 months, I have been dealing with MRSA. It's a antibiotic-resistant infection, and unfortunately, it's actually been in my stoma, making using my feeding tube extremely painful. Just touching it, moving it, using it, anything, it really hurts. To the point that my mom, after I would clean it at night, she would sit with me to make sure that I didn't pass out or throw up from the pain. And it's been rough, having your lifeline pretty much infected like that, and causing you so much pain to the point where I stopped using it except for medications. I kind of gave up on it. I was like, I just want to get rid of it, pull my tube. I don't really care what happens afterwards. We'll deal with my nutrition and everything later, but, I can't deal with the pain anymore. And, thankfully I have a really great doctor who had helped me through it after a bunch of doctors not taking my infection seriously. He made sure I got the IV antibiotics that I needed, the treatment that I required, and everything we did, it still wasn't working. So when we talked at the fundraiser, we decided it was time to start TPN and pull my feeding tube. Then he talked to the infectious disease doctor and wanted to wait a little bit longer and see what would happen if we extended my antibiotics that I was on. I was on IV Zosyn, which is a penicillin-based medication. It's got 2 names in it, and I can't remember what it is, but it's supposed to be a stronger antibiotic. And we extended it, and things just were not getting better. And one morning I woke up to an email from Dr. Risk after sending him pictures of my stoma and of the discharge that was on, how much discharge and the color of the discharge. I woke up to an email saying that we need to admit me to the hospital to get my tube pulled and start TPN, to contact him to let him know when to start the process. I emailed him right back, and he had me come into the office that afternoon, and this was the 10th. He had me come in, we talked and everything. He put in the admission, and they had a room ready for me at like 5, so not much happened that day. Friday, I had a CT scan. They wanted to make sure there was not like pockets of pus that they were missing, or other things going on inside. So that entitled contrast, and I have an IV contrast allergy now. So I had to do a contrast prep, which is IV steroids and IV Benadryl, to make sure that it didn't bother me. And of course, they had an anaphylaxis kit ready in case that didn't work. Thankfully, it did. I had like 10 contrast preps while I was there. It was ridiculous. So we had the CT, and then nobody came up to talk to me. All of a sudden, they were starting another contrast prep. So they had talked about checking the position of my feeding tube, so I figured that's what they were going to do. But when I was taken down to IR, I was told they were going to change my feeding tube. When we had talked to the doctors on Thursday, I had explained to them, due to my visceral hypersensitivity, I had to have anesthesia. Not even conscious sedation would work. I've tried it, and it was painful, and it can't happen. Unless I'm under anesthesia, I'm not going to sign the consent to have anything done. And I was pretty clear about it, and they said okay, they understood, and they wanted to try and get my tube changed right away. So I was wheeled back up to my room because now I had to wait until they could get IR and anesthesia together, and it was like end of the day Friday, so I knew it wasn't going to happen. They started me on TPN on Saturday. TPN is total parenteral nutrition, and that goes in through my port, and I'll give you guys a little more information on that in a few minutes. And I had to wait the weekend. So while I was on TPN for 24 hours. On Monday, they decided before changing my tube, they wanted to do an endoscopy, which is a camera down my throat into my stomach, and they wanted to check to make sure I'm not having an allergic reaction to the tube itself. So they wanted to check my stomach, and then they wanted to check the part of my small intestines, and so that was done, and thankfully I'm not allergic, because one of their thoughts was all the mast cell problems I'm having. They wanted to make sure that, you know, I'm not all of a sudden allergic to my feeding tube, and that's why this infection won't go away, or, you know, if maybe that's contributing to the infection. So they took biopsies and stuff. Everything was okay. They emptied my stomach for me because they said there was a lot of fluid in there. And the next day, Tuesday, I had my feeding tube changed. Now, the way it is I have a button. So if this is my stoma, the button sits right here, and then the tube comes down, and there's a balloon on the other side of my stomach to keep the tube from coming out. There's different lengths between the button and the balloon itself. Originally, I had like 3.5 centimeters. They actually shortened it to 3 centimeters. I believe it's centimeters, if I remember correctly. And so now the balloon, since it's shorter, it's tighter, and the top sits there, puts a lot of pressure on my skin, and I have raw skin from the infection, so I don't know how that's gonna affect my healing process. Right now, it doesn't look too good, my stoma, so I know I'll be on TPN for at least a month, and if we have to extend it to 3 months, we will. If we have to extend it more, then we're just going to completely pull my tube and let that heal and go from there. It has not been a fun ride. It's been very painful, and I'm ready to have it over with. So Monday, I believe it was, they started cycling me on TPN because we knew I was going to be sent home. And what it is with the cycling is they're slowly, for the first 2 hours, the rates are different. So they started the rate, like, say at 40 milliliters per hour, and then they upped the rate once more, and then they upped the rate another time, and it was like that for like 14 hours, and then they down the rate once, and then they down the rate another time after an hour. And so they did that, and that's how they got me on 14 hours of TPN. I do 2 hours of titrating up, and then for 10 hours I'm at one rate, and then 2 hours of titrating down. That way it doesn't mess with my blood sugar too much. TPN can, especially, brain fog. TPN really can mess with your blood sugar. It can either make it too high about 3 or 4 hours in, or it can drastically drop your blood sugar at 30 minutes after you stop completely. So they try to make it easier on your system by having the pump titrate up slowly to that rate over 2 hours, and then titrate down to 0 over 2 more hours at the end. So right now I'm not getting any lipids. This is what my TPN bag looks like, and this tells you everything that's in it. So contents are Freamine 3, dextrose, which is sugar, potassium phosphate, potassium chloride, sodium acetate, magnesium sulfate, calcium gluconate, multitrace 5 concentrate, sterile water for injection, and it's got 1,500 milliliters for me to use and 100 milliliter overflow, so 1,600 total. And then Mondays through Fridays, I gotta get these back in the fridge. I do vitamins. So what it is I draw out these vitamins and I inject them through this into the bag, and that's what makes my bag yellow. And then the pump that I use, does not want to come off. So this is the pump that I use. There's the on button. You turn it on, and it literally does everything for me except prime the line, which I have to do by holding down this purge button. And it's a little bit annoying because if I lift my finger off of it for a second, then it's going to say, is purge complete? And I have to answer yes or no. And then I have to wait for it to go through this whole thing again. And if I answer yes by accident, then I have to press purge again, and it says prime line, and I have to say yes. And then it tells you to disconnect the tubing from the patient, and then it's just a lot of confirmation and stuff. So like here, using batteries, so I have AA batteries in here, and those last about 12 hours. And then I have an external battery that lasts like 2 days or something. And so I would do resume programming, and that battery I charge every day, and that's the battery I could use, say, if I wanted to go out and put this in my bag, and then I can actually use it. What charges the battery is can actually fits here too, and that's what I can use for the pump at night, except I've been using the battery because it's just easier in case I need to go to the restroom. It keeps that it's like using a blender with the connection. Okay, so like here, like everything is locked so I don't mess up stuff. So it'll tell you like TPN with taper, TPN volume 1,500 milliliters, taper up over 2 hours, taper down over 2 hours, and TPN time total is 14. Sorry, Frenchie was eating a rubber band. And then it'll tell you here, 5 milliliters per hour KVO. That means to keep my vein open. So after the 1,500, if I don't hear it beep, it'll only beep once. So if I don't hear it, it'll do the 5 milliliters per hour until it uses that 100 milliliter overflow, and then it'll start beeping continuously. And it's a very annoying beep that you guys just heard. And then container size is 15, so say 15 or 16, 1,600. And the air alarm is 2 milliliters, and this is where the cassette goes, and that's where it would alarm for the, and then there is no cassette, and then you would just press enter, and that's it. And then it's really easy. If it'll tell you how much infused, and so you kind of have to reset that by pressing change. And because I don't have a cassette in, it won't work. But I mean, that's pretty much. It's very simple. I mean, they came in. Can you like? Oh crap. There we go. There we go. It doesn't like to be on when there's no cassette in, and it's very hard to turn it off when there's no cassette in. so it's annoying. But so that's my setup. So now I have my Joey pump over my TPN pump, and all it uses is my port, so it hooks up to this. And I usually start at about 7 or 8 o'clock, and I'm done by 10 o'clock the next morning. So it hasn't been too bad, but it's definitely a change. You know, I'm definitely always concerned about if I feel different, you know, how I'm feeling, you know, is it the way I should be feeling, or is something wrong? I mean, it's similar to like how it was with my tube feeds, but I think it's a little bit more worrisome to me, because it is a great infection risk using your port constantly like that, and on top of that, TPN, it goes to the liver, and so it's hard on the liver. The lipids are the worst, but it's still in your blood, and so I guess my mindset is always concerned about infection and something going wrong. No matter, hopefully I'm not on CPN long enough to feel as comfortable as I was with my feeding tube. I'm really hoping after a month and a half, we can get back to tube feeds and get off of TPN. I'm still having a really hard time bouncing back. I'm exhausted. My memory is not with me. And so I'm hoping in a week or so that'll be better. And the other thing I wanted to talk about is August is almost here, and that is Gastroparesis Awareness Month. So I'm working on a video about my story, because I haven't done that yet. And I'm working on another video, which I will probably put out before August, if I get it finished. And I'm hoping to do a couple of giveaways on my page. So again, www.facebook.com/DaliasFight, and that's DALIAS fight. And I'm working with Vials of Love. I'm getting that Etsy page up. I'm really excited to get that out there. So spread the word, spread the love. It's a good way to spread awareness. It's a good statement piece, whether it's jewelry or keychains, however you want me to make it, I can do it. And then I am hoping to make a trip out for my birthday, and that's about it. If you guys have any questions, let me know. I want to get working on these videos. I'm really excited to get them out. I want to work on the first video. It's more of a chronic illness video, but it's different than what I've usually been doing, and so I'm really excited about it. And then my story, I'm going to do a few different things for Gastroparesis Awareness Month. Like I said, I want to do a couple of giveaways on my page, and I want to do a couple of different gastroparesis videos. Again, different from what I've been doing. I want to stray away from the straight talking videos and do something kind of more eye-catching. And I will do some of these types of videos still, but I want to really grab people's attention with these videos. So hopefully, fingers crossed, the videos come out the way I want, so I can post them. If you have any questions, contact me. Other than that, have a wonderful day.